What costs are not included in Medicare premiums? Attention everyone. A pressing question is on many people's minds. What costs are not included in Medicare premiums? With recent discussions around healthcare costs, understanding this topic is more important than ever. If you are navigating Medicare or planning for future healthcare needs, you may be curious about what is covered and what is not. Medicare premiums, like those for Part B and Part D, only cover part of the total costs associated with Medicare services. For example, in 2025, the standard premium for Medicare Part B is $185. This amount covers about 25% of the overall cost of Parts B and D combined, with the government subsidizing the rest. However, there are several costs that Medicare premiums do not cover. First, deductibles and coinsurance are not included. After paying the Part B premium, beneficiaries are responsible for the Part B deductible and typically 20% coinsurance for outpatient services. Next, prescription drug costs beyond premiums are another area of concern. While Part D premiums cover some prescription drug costs, beneficiaries often face copayments, coinsurance, and deductibles for medications not covered by premiums. Additionally, certain services are not covered by original Medicare. Long-term care, most dental care, exams related to prescription glasses, hearing aids, and routine foot care are generally not included. For those enrolled in Medicare Advantage plans, additional costs come into play. While they may pay premiums, they also face extra costs like copays, coinsurance, and deductibles depending on their specific plan. Higher income beneficiaries should also be aware of the income-related monthly adjustment amount. This is an additional premium surcharge on top of the standard premium, which is not included in the base amount. Some low-income beneficiaries may have their premiums and out-of-pocket costs covered by programs like the Qualified Medicare Beneficiary Program, but these costs remain separate from standard Medicare premiums. Finally, any services outside Medicare coverage or received from providers not accepting Medicare assignment may lead to additional charges not included in premiums. In summary, Medicare premiums cover only part of the overall expenses related to Medicare services. Beneficiaries should be aware of additional costs like deductibles, coinsurance, copayments, and charges for services not covered by Medicare premiums. Understanding these costs can help you better prepare for your healthcare expenses.